Hello friends, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist at Apollo Hospital and at Helios Cancer Center. Today I am going to talk to you about rectal cancers. Rectal cancer is a fairly common problem in India. Though it does not figure among the top 1 or 2 cancers, it's not that uncommon also, and I am sure we would have come across quite a few patients suffering from rectal cancer. Before talking about rectal cancer, let me just take you through where the rectum actually is. For this, I'll draw your attention towards this picture, and you can see that the rectum is actually the terminal portion of the gut, just above the anal canal. This part holds the stools before it's excreted out, and cancer of this part is called rectal cancer. How does rectal cancer present? The most common way it presents is bleeding in the stools. The bleeding can either be mixed with the stools or it can be frank blood also. Again, I must tell you all that not all bleeding means rectal cancer. There are many other more common causes of bleeding, such as hemorrhoids or piles, as it is called. But when an elderly patient, say above the age of 60 years, has bleeding per rectum for the first time, then this warrants more attention and a more serious investigation for rectal cancer. Some other patients present with altered bowel habits. Most of them complain of altering diarrhea and constipation. A few of them present to us with frank obstruction like bloating and vomiting and such symptoms. And a small fraction of them present directly with metastasis in the liver, lungs, or sometimes in the brain. So these are the common ways in which rectal cancers present. So any of these symptoms are there, please visit your doctor for more investigations. The first thing which the surgeon usually does is a digital rectal examination. This is an important part of rectal examination. So with the gloved finger, the rectal examination is done and the surgeon is able to see whether there is any mass which is felt. And if a mass is there, the next step is to take a biopsy from it. Also, not all masses may be palpable from below. Masses which are higher up, they require visualization with the endoscope, and we call this process a colonoscopy. So colonoscopy is a very important part of rectal cancer evaluation. One, to diagnose rectal cancer, take a biopsy. And since a few of them can be multifocal, that is, more than one tumors might be there or other polyps might be there, the entire colon has to be visualized. So colonoscopy is an important part of rectal cancer examination. So as I said, the biopsy will be taken, it will be sent to the pathologist. And once there is a confirmation that the person has a rectal cancer, the next step would be to stage the disease. That is, we have to see how extensive the disease has spread. So the spread we need to see locally also, how much it has spread around the rectum and how much it has spread far away. The commonly performed test to see the spread in the nearby area is a rectal MRI or a CT scan. And to see the spread far off, we do what we call as a PET scan, which will detect where all in the body the cancer is affected. With rectal cancer, very often we do a tumor marker called CEA or carcinoembryonic antigen. This is an important test for follow-up of the patient. That is, CEA should drop after the treatment, and the CEA is one of the initial signs. When the CEA starts going up after treatment, then we are worried about recurrence. Now, what causes rectal cancer? Like any cancer, there is no simple answer to this, but we do have some information as to what predisposes a person to rectal cancer. There is some genetic tendency. We do see in about somewhere in the range of 5 to 10% of cases, we see a familial predisposition, and there certain genes have been identified which can be transmitted from generation to generation, causing increased chances of rectal cancers in families. Apart from this, a few patients during their colonoscopy are detected to have polyps. Some of these polyps can be pre-malignant. That is, over time, they can go on to become rectal cancers, and the presence of these polyps predisposes the person to develop rectal cancer. Dietary habits, increased consumption of meat and other fatty products are attributed to increased rectal cancer, especially in certain populations. But in a simple answer, we don't have one single definite cause for rectal cancer. As I said earlier, after doing the biopsy and confirming the rectal cancer, we stage it through various investigations. And the stages can be 1 to 4, 1 being a very early small cancer and 4 being spread to other areas like liver and lung. The treatment will depend on the type and stage of the rectal cancer. Broadly, early rectal cancers are treated by surgical intervention, and the more advanced ones need a combination of chemotherapy, radiation, and surgery. I will discuss more about each type of these of the treatment. In early rectal cancers, the main treatment is surgery. If we get a very small rectal cancer which is close to the external opening, we can just do a transanal excision. That is, just from below we can remove only the tumor, doing nothing for the rest of the rectum. Here the treatment is simple. This can be done only for select very early rectal cancers. Stage 1 rectal cancers, which are bigger, the commonly performed surgeries are what we call as anterior resection, where we cut the two ends of the rectum and join it, and the other surgery which is performed is the abdominoperineal resection. These are done for tumors which are very low down, almost in the anal canal, where the entire rectal passage has to be removed and the patient has to be given a permanent colostomy. As the stage increases, say we get a stage 3 rectal cancer, here broadly the treatment would be a combination treatment. Usually we prefer that the patient undergoes chemotherapy and radiation first for a period of around 6 weeks, and then take him up for surgery at a later date. The reason for this is that the chemotherapy and radiation shrinks the tumor, making the surgery more amenable, and also in those cases in which preserving the sphincter or the natural passage is difficult, by giving chemotherapy and radiation, we shrink the disease, making sphincter preservation easier. Stage 4 rectal cancer is one which has spread to the liver and lungs. Now, even in stage 4, certain rectal cancers can be cured. This especially is true if the disease is limited to just few areas in the liver. Say there is just what we call as a liver limited metastasis, or just 1 or 2 metastases in the liver, and rest of the body apart from the primary in the rectum is clear, we can go for rectal surgery for rectal cancer along with the removal of these liver lesions. So, prognosis for rectal cancer is fairly good, and it is possible to achieve cure in a decent number of cases. Thank you.